So it's really interesting. Complementary and integrative medicine, in my mind, I put into three different categories. One is nutraceuticals, so our supplements that have been shown to help with migraine prevention, such as magnesium, riboflavin, coenzyme Q10, and other vitamins. That's the first basket, is those nutraceuticals. The second basket I kind of think about is mind-body medicine. So approaches such as meditation, mindfulness, just to, just two mechanisms there that come to mind when I think about mind body. And then I think about the third category being body-based maneuvers, such as acupuncture, where you have a specialist, for example, who specializes in acupuncture that's performing a procedure or a body-based maneuver on the patient, such as acupuncture. So those are kind of the three categories. And basically, we sent out anonymous surveys to patients using a social media platform. We specifically sent out the survey anonymously with IRB approval to members of the Move Against Migraine group, which is a really large group with over 20,000 members, led by the American Migraine Foundation. Patients were surveyed and asked if they have tried, patients were first confirmed to have a prior diagnosis of migraine, and they were specifically asked if they have tried complementary and integrative medicine, who has been recommending complementary and integrative medicine, which modalities have they tried in the past. And we received hundreds of surveys. It was about almost 400 responses to this survey. The vast majority of people, 80% plus, had tried an integrative medicine approach or a combination, multiple integrative medicine approaches together. And the vast majority of people in this study who had tried these different integrative medicine approaches in combination or separately reported them being slightly effective. We asked them if these treatments were not effective, slightly effective, moderately effective, or very effective. And in their opinion, they reported that they were slightly effective, which is kind of what we expect, to be honest with you. Integrative medicine approaches do not have the robust evidence that these pharmaceutical treatments have, such as these large randomized placebo-controlled trials. And so that's they have smaller studies that have looked at them, those nutraceuticals, mind-body approaches. They're smaller studies. And so we always recommend them as something they're added onto mainstream approaches rather than being used individually. Because honestly, in my clinical experience, I find adding them can give the patient some additional relief from their migraine attacks, but it's not going to be a one-size-fits-all slam dunk treatment. So that pretty much is what our study confirmed. The other interesting finding from the study was that I believe it was around 50% of patients in the study had also tried cannabis or cannabinoid derivatives to treat migraine, and we know there's no evidence for the use of cannabis or cannabinoid derivatives for the treatment of migraine, but they had tried it out, so it's a very popular thing that patients are trying and we may not have knowledge about. So it's really, this study just confirms the importance of really asking your patients, what are they doing outside of what you're recommending? Because many patients, this study shows, will go take matters into their own hands and try these natural approaches with or without the help of a physician. So it's really important to open that conversation from a non-judgmental, caring approach and ask them, what have you tried? Why did you try it? And it's important for us as physicians to be educated on the dangers of integrative medicine, what's safe, what's not safe, and the possible side effects of some of the nutraceuticals and other treatments available. So that's kind of the study in a nutshell.